Hello, my name is Rosalind and this is an EFT tap-along video. It will allow you to use EFT, emotional freedom techniques, very simply, and also to address a specific aspect of recovering emotionally after a miscarriage. This particular video is the third in a series of three things you should know about recovering after a miscarriage. So, in a moment we'll get on to what that third thing is, but just before we do, we've reached the point which you'll find in all of my videos where I say to you that you must take full responsibility for your own well-being as we tap. The reason for this is that tapping is a little bit like peeling the layers off an onion and stuff can come up. So if you've been suppressing emotions, or if you've been under the care of a doctor, or if you've been seeing a therapist, or maybe you suspect that you should, then you might like to consult someone before you use this. Or at least make sure that you have someone with you to support you as you tap. And it's very rare that that happens, and if, as we go along, strong emotions come up, chances are they can begin to ease as we continue to tap. Okay, so in a moment, not just yet, but in a moment I'm going to ask you to copy me, to repeat what I say and to tap where I tap. But first of all, I was going to talk to you about what that third thing is, the third thing you should know about recovering emotionally after a miscarriage. So the third thing is, if you have experienced upsetting or traumatic events in the process of the miscarriage, then that can make it all more difficult to deal with. So miscarrying is an upsetting thing and it's a grieving process, and that's hard enough as it is. But if on top of that you have experienced particularly upsetting or traumatic incidences, then that can make it all feel that much more overwhelming. And you may be disoriented, you may be shocked, you may find that you're being haunted by distressing memories or dreams. Depending on how serious it is, there may be memories which are intruding into your day-to-day life. And also depending on what you've experienced in the past, recently or over the years, if you've had bereavements or other traumas or losses, it can be that this can be cumulative and just more to cope with than you can really deal with easily. And it is possible to relieve trauma like this, and not everybody knows that. So that's the third key thing I think everybody should know, is that on top of the grieving process, if you're also dealing with upsetting or traumatic incidences, then that can make it that much easier, that much harder to cope with. And I just wanted to let you know that the purpose of this particular video is not to make those traumatic memories go away. And when we're going to tap, we're not trying to do that in this particular video. But what I wanted to do was to flag up for you that this might be happening, and to validate what you're experiencing, and also to provide reassurance, to let you know that there are ways to make the strong emotions that are attached to upsetting memories go away. So what it can feel like, if you've had some very upsetting things happen, is it can feel like they're right here, right in front of your face. They may not be there all the time, but they can be there when you least want them to be. And that can be very, very upsetting to cope with. And the techniques which I use, EFT and also TAT, can have the impact of sort of taking those upsetting memories away, and they have the chance to sort of float down and diminish. And people talk about it as if it's like watching it on television. So somebody who may have had a very upsetting or traumatic incident that we've dealt with will say, well, it's as if I'm watching it on television. So I can see it, it's over there, it's a very long way away now, it doesn't feel as if it has anything to do with me, it's not pleasant to watch, and I know that it happened, but it doesn't hurt anymore. And I wanted to let you know that it's quite possible to do that with upsetting memories. But as I say, the intention of this particular video is not to do that with those memories, but I wanted to let you know that you can do it, and to point you in the direction of knowing how to deal with it. So I actually have other videos which talk about specific techniques you can use for that, and there's some information about that just here. And of course the easiest way, the most straightforward way, and possibly the kindest way, is to work with an experienced professional. So I would recommend working with somebody who's very experienced either in EFT, emotional freedom techniques, or TAT, tapas acupressure techniques. And there's information about both of those on my website. It's www.tapas miscarriage-support.com. And so I just wanted to warn you that we're not trying to make those memories go away now, but at the end I will also talk about some techniques which you could be using right now to support you in that. And so let's just tap along about this third point which we've talked about. Okay, so now I'm going to ask you to copy me, to repeat what I say, and to tap where I tap. And actually there's something I should say, which is, don't worry if the words I say don't completely match how you're feeling now. The tapping will have a beneficial impact anyway, whether the words match exactly or not. Now, if you would like to change the words so that they do reflect exactly what you're feeling now, feel free to do that. So, for example, I might say, I feel sad, but you might want to say, I feel really sad, or I feel numb. So do feel free to change them so that they're reflecting what you're feeling now, if you would like to do that. There's no requirement to do that. It will work perfectly fine if you just repeat everything I say. But if you do want to change some of the words, please feel free to do that as well. Whichever you choose is perfectly fine, and you can change your mind in the moment. Okay? Great. So now I'm going to ask you to copy what I do, to tap where I tap, and repeat what I say. Even though I've had a miscarriage, I'm okay. Even if I don't feel okay. And this isn't okay at all. And I know I'm doing my best. Even though I've had a miscarriage, and I may have been through some really awful things, I am okay. Even if I don't feel okay, I'm still here. And I know I'm doing my best, and I have been doing my best throughout. Even though I've had a miscarriage, I may have had more than one, and I've been through all of this, and I am still going through it. I am okay, even if I don't feel okay, and I'm doing my best. Okay, let's tap round. I've had a miscarriage. I've been through all of this. I've had a miscarriage. All of this upsetting stuff. Everything I've been through. Everything I'm dealing with. All of these emotions. All of these feelings. It may be hard for me to cope with. There may be difficult memories. And I may have put them away in a box somewhere. And I may be trying not to think about them. All of these things I've experienced. And I am okay. Even if I don't feel okay right now. I'm still here. And it's possible for me to get over this. And I will be okay again. And this will pass. Okay, let's pause and take a deep breath. And let's continue to tap. Even though I may have very strong emotions, I'm okay. Even though I have all of these feelings and all of this stuff I've been dealing with, I am okay. Even if I don't feel okay. And I will be okay again. Even though I've had a miscarriage and I've been through all of this, and it can be very shocking and upsetting, and I may not feel like myself at all, and I may be wondering if I'm ever going to feel like myself again. I'm okay, even if I don't feel okay, and I'm doing my best, even if that doesn't feel good enough. All of these things I've been through, all of these emotions, all of these feelings. I may not feel like myself at all. Sometimes I might struggle. Might be a lot to cope with. All of these strong emotions and feelings. All of the things I've been through. All of the stuff I'm going through now. I may not feel like myself at all. It may be hard for me to cope at work. I may be wondering if I'm ever going to get back to normal again. All of this stuff I'm dealing with and have experienced. I am okay, even if I don't feel okay. And I will be okay again. And I will be able to get through this. Okay, let's pause and take another deep breath. Okay, let's continue to tap. Even though I may be back at work, physically I may be recovered, emotionally I may still be reeling, I may be struggling, and I'm okay, even if I don't feel okay. And I will get over this eventually. Even though I've had a miscarriage, physically I may be better, but emotionally I may be struggling. And I choose to know that this is part of a grieving process and that there are ways to help with this. It takes time, but if there are also upsetting memories, it is possible to ease those, and that can make it all a little easier to cope with. And I'm okay. Even though I've been through all of this, and I'm still going through it, and physically I may have recovered, and emotionally I may still be reeling and struggling to cope, I choose to know that I will be okay eventually, and I'm doing my best, and this will pass, and I'm okay. Physically I may be recovered, and I may not. Physically I may be able to go back to work. Emotionally I may still be reeling. I might be distracted. I might be finding it hard to cope. I might find waves of emotion coming over me. And there may be emotions, and there may be painful memories, and that might be making it harder for me. All of this stuff that I'm dealing with, everything that I've been through, all of this stuff that I'm dealing with, all of these feelings and emotions. I may be confused. I may be frightened. I may not feel like myself at all. I may be scared I'm not going to get back to myself again. It might be overwhelming sometimes. I might struggle to cope with all of it sometimes. All of these feelings and emotions. And there might be painful memories too. And I'm going through a grieving process. And this takes time. And I will get through it eventually. And time does heal. Even though I may be wondering how I'm going to cope with all of this, and there may be emotions and memories that I can't cope with, I may have pushed them away, and that might be appropriate. I'm okay, even if I'm not okay, and I will be okay eventually. Even though there's all of this that I'm dealing with, and I might be wondering how I'm going to cope with all of it, whether it will ever go, what I can do to make it easier. I choose to know that if I need help and support, it is out there, and there are techniques that can be used to diminish the painful emotions, to make it feel less, to make it feel more distant. And it is possible for that to be done. And I'm okay, even if I don't feel okay. And it's possible that I could use those if I need to. Even though I've been through all of this, and sometimes there are strong emotions, and maybe there are painful memories, I choose to know that I will get through this, and that I'm okay. I'm still here, even if I don't feel okay. And I'm doing my best, even if that doesn't feel good enough. I'm okay. All of this stuff I've been through, all of these feelings and memories, they may feel too much to cope with sometimes. I'm going through a grieving process, and that takes time. And if there are memories I can't cope with, there are techniques out there, and there are people I could work with who can help me, who can help to make the painful feelings go away, who can help to diminish the pain associated with those memories. It's possible to make those memories feel as if they're a long way away from me and not connected, as if it's like watching it on television. It's possible for that to happen. And if I need it, it's possible for me to ask for that help and that support. And I don't have to struggle through this on my own. And I am okay, even if I don't feel okay now. And I will be okay eventually. And I can ask for help and support if I need it. And I can talk to family and friends. And I don't have to go through this on my own. Okay, let's pause and take another deep breath. Even though I may not know how to access help if I want it, I am okay. Even though part of me may not think I'm allowed to do that, I may not think I deserve it, I may not be sure if it's okay, I may doubt as to whether it works. This is all quite weird after all. And I'm okay, even if I don't feel okay right now. And I'm doing my best. And I always have been doing my best. Even though it may not feel possible for me to ask for support, to get the help I might need, it's possible that I can ask for help if I need it. That I don't have to go through this on my own. I'm worth being helped, even if I don't feel it right now. And I'm allowed to ask for help. And if I feel like I could do with some, it is appropriate to get help. And I'm okay, even if I don't feel okay. And I choose to remember that I will get through all of this. And I'm doing my best. It's okay to ask for help if I need it. There's nothing wrong with asking for help. Doesn't mean I'm mad or a failure. Doesn't mean I'm weak if I ask for help. I'm allowed to ask for help if I want it, and if I think it would help me. I'm allowed to seek help from people who can support me. That might be appropriate. If I'm finding this hard to cope with, if there are particularly painful memories, if I'm having really bad dreams, if it's getting in my way, I choose to remember that there are techniques which can help to diminish all of this, to make it feel far more distant and much less painful. It's not that I will forget it's happened, but it will be more like watching it on television. I know that it happened, and it's not pleasant to watch, but it's possible to make those strong emotions go away from those memories, so that I can feel detached from it. And if I feel that that would be helpful, then I am allowed to seek help with that. That's an appropriate thing for me to do. If my mind was clearer and these unpleasant memories were gone, it would be easier for me to live life normally. It would be easier for me to concentrate on my work. It would be easier to cope with family life. If I want to be pregnant again, that would make that easier. I choose to remember that it is possible to use self-help techniques like this one, and in the hands of a skilled, experienced professional. It's possible to make all of the unpleasant emotions attached to unpleasant memories disappear. Even though that sounds unlikely. And if that would be helpful for me, I am allowed to ask for that. And I deserve that. It could make lots of my life easier. Easier to cope with work. Easier to cope with the grieving process I'm going through. If I'm thinking about being pregnant again, easier to cope with that. I'm allowed to be supported if I need it. That is appropriate for me. And I choose to remember that I can ask for help if that feels useful for me. Okay, let's pause and take another deep breath. Okay, so I'm going to ask you to stop repeating what I'm saying just at the moment, but I would suggest that you do continue tapping. You might like to tap on the karate chop point here, or you might like to tap on the collarbone point here. Either of those, I'm going to tap as we talk, because I just wanted to talk to you about one particular option. So it may be that it would be helpful for you to work with somebody to deal with specific upsetting or traumatic memories. That might be helpful. It may be that you don't need to do that. One technique which I can suggest, which you could do right now, relatively straightforwardly, is to use simple tapping. And simple tapping, I talk about that at length on my website, and there are videos which teach you how to do simple tapping, but simple tapping is very easy and very straightforward, and it involves just tapping or rubbing or holding any of these points which we've been tapping on now. You don't have to use all of them, you don't have to say any words at the same time, you don't have to be focusing on anything at the same time. You just tap or rub or hold any of these points. And you might find that if you used simple tapping, particularly if you use that on a regular basis, if you used it every day for weeks or months, that might have a big impact, and you might find that those memories go from being like this to just kind of floating down anyway. Sometimes it's helpful to explicitly address specific memories with somebody who's trained to help you in that, who can support you and make it as painless as possible, and as simple a process as possible, and will just guide you through it gently. But that's not necessarily necessary. You might find that if you just do simple tapping, that over time that will settle it all down, will allow you to feel better able to cope. If you are putting the memories in a box somewhere and sealing them over there, that might be more effective. Partly depends on how serious what it is you've experienced is, really. So I wanted to let you know about that, and to say that if you're interested in the simple tapping, which is what I'm doing now, any of these, they're all simple tapping techniques, then please do go and have a look on my website and look for one of the simple tapping videos. There's one called An Introduction to Simple Tapping, and there's also a quick start introduction to simple tapping, and there's also a sheet you can print off if you want to know how to do that. So I would strongly encourage you to do simple tapping if nothing else, and you might find that you don't then need to specifically tackle other stuff. You might find that you do, whichever time, I think time will show. Certainly if you do want help, I would strongly recommend going to see somebody who's experienced. That's so for an EFT practitioner, that's somebody who's advanced, or a trainer, or a TAT professional, or a TAT trainer. And they will take great care of you and make sure that the whole process is as painless as possible. But as I say, you might find that just using simple tapping, that might help to diminish the level of strong emotions that you're experiencing, and that may be all you need. Okay? So, I hope you're feeling a little better now than you did when we began tapping. Thank you very much indeed for taking the time to tap with me. I really appreciate that. If you would like to see more videos If you would like to know what else I can offer or how I might work with you individually, wherever you are in the world, please do look on my website. That's www.miscarriage-support.com. And if you need help, please ask for it. And take care of yourself. And thank you very much for joining me, and I look forward to seeing you again. Thank you.